Our teams, let's face it, they're tired. You don't need to ask me. You can talk to anybody who works in healthcare. They're tired.
And this third summer of COVID-19 isn't giving BC's healthcare staff or systems any slack. In fact, heading into the thick of summer, things are getting harder for those on the front lines with a high level of sickness, including in healthcare.
The healthcare is a good way to measure. About 5 weeks ago, we had about 15,000 people off sick. This last week, it was 16,400. And that, in the way that we test, that is a way to measure apples to apples.
The good news right now, he says, is that hospitalizations, another COVID marker, have been trending down for a couple months. Even as overall infections are increasing in this latest COVID surge, where we all know someone, he says, who've had it recently. Infectious disease expert Dr. Brian Conway thinks of it now as endemic, in saying COVID is with us for the long haul.
We've shifted from responsibility imposed upon us by public health authorities to personal responsibility, and we have to take that responsibility to keep the numbers down.
It's the same basics, he says, impressed upon us throughout the pandemic.
Get your shots if you haven't gotten them. Stay home if you're sick. Have a mask on your person to wear when it is appropriate to do so. And keep washing your hands as you've learned to do.
Vital heading into fall when other respiratory illnesses are going to spread, as well as COVID. The province planning for fourth doses for everyone.
Both Pfizer and Moderna by the fall will have an adapted vaccination that will be more effective against the Omicron variant and its descendants, the BA4 and probably the BA5.
While the province does have strong vaccine uptake, there remains a staggering number of people not getting all the protection available to them.
1.3 million people are eligible, have received an invitation to get vaccinated.
But they just haven't gotten that booster yet. But 2.8 million people have. And when it comes to the next booster, Dr. Conway hoping for consensus among all Canada's health officers.
Everyone says they're based on science and they're coming to different conclusions. So that's confusing people like me.
And for many who aren't experts, he worries this means they'll just check out.
The risk you run by having these different messages is people just check out and don't get the vaccines at all. And that is my biggest concern. That's why I would invite them to get together as soon as possible and lay out a clear message for all Canadians.
In Victoria, Liza Yuzda, City News.